Hello and welcome. I'm Beth Pike with the State Historical Society of Missouri. Hope you are doing well. While we are living through a world pandemic, we look for answers. And some of our query takes us back to the 1918 flu pandemic. Today is a part two of this topic presented by Kathleen Seale, our senior archivist at the Rolla Research Center. Katie will speak more specifically on how various organizations in Missouri responded to the 1918 flu pandemic. Now, a couple of housekeeping notes before we get started. At the end of Katie's presentation, we will open it up for your questions. And at any time during Katie's talk, you can type in your question by clicking on the Q&A button on the bottom of your screen. Now, we can't see or hear you, but at the end, we will read your questions and Katie will answer in the order it's received. So thank you to our members of the State Historical Society of Missouri who are joining us. Your annual membership helps us continue programs like we have for you today. So if you're not a member or it's time to renew, we invite you to join our society online at shsmo.org. Now let's rewind 100 years ago. Much like today, Missouri and the rest of the world was fighting a deadly virus. Welcome back to the program, Katie, for part two.
Thanks, Beth. Hi, everybody. So for those of you that were here for part one, we looked more at what did the flu actually look like in 1918 here in Missouri. So now we're taking a different step and looking at what is the response across the state of Missouri from different organizations and individuals. What did Missouri do to combat the flu? So some of the places that we are going to look at that response is going to be the government. So we're going to look at that national level, how that might have affected Missouri and its people, but then also the state and local, just to get that more Missouri feel. We're also going to look at the military, the American Red Cross, and this one kind of jumped into the middle of it during my research. It came out, but also churches, which is a little interesting tidbit that comes out, but also universities and the medical community here in the state of Missouri. There's a little bit of overlap between the two of those. We had some medical colleges here in the state of Missouri. So you see both of them being involved as far as response care for the sick in that aspect of it. So looking at a national response, here we've got a quote actually from President Wilson. So this was in early October 1918, and he says, "I have had representations sent to me by men whose ability and patriotism are unquestioned, that I should stop the shipment of men to France until this epidemic of influenza is under control. You decline to stop these shipments." So this was said to the Army Chief of Staff, who is General Peyton March at this time in early October. So this is when you have those first waves of the flu going across the nation. You see large numbers in places like Boston and Philadelphia, mostly starting in those military bases and training camps, and then kind of expanding from there to the civilian populations. What's interesting about this statement is it's kind of twofold. So at the beginning of it, you see where he makes this statement that the men that are coming to him with these concerns about shipping soldiers either around the nation or overseas who are possibly have the influenza, could further spread the disease, he has to make that caveat that their abilities and their patriotism are unquestioned. If you remember from part one, during this time in May of 1918, we just had the Sedition Act passed. So any utterance against the government or the war effort, anything seen as a hindrance against that, you could be tried for that, and there's fines and even possible jail time involved. So he has to make that caveat that even though these men are coming with these concerns, the fact that they even made these statements out loud is kind of astounding for the time period in which we were living in. But he had to make that caveat that, you know, they're not being disloyal, they're just bringing these concerns forward. Also, while President Wilson makes this statement, that's really as far as it goes. There's no slowdown as far as the war effort. There's no national leadership as far as politicians making any sort of statements or restrictions that I could find or come across in regards to the influenza outbreak. It really is all hands on deck in regards to the war effort. All of the kind of national focus is really placed on that. And so you don't see them contributing to that response as far as how do we combat and go against that. On the other hand, there are some agencies across at a national federal level, such as the United States Postal Service, and also the committee of the American Public Health Association, which is associated with the Public Health Service, that do make a response. So the Postal Service, they are still fully running during the entirety of this pandemic. However, you do see instances where services are reduced or even suspended in some cases. I found that mostly in Western states, where all of the mail carriers, the clerks, the sorters, anybody in the office, that sort of thing, had come down sick with the flu, and there simply wasn't anybody to deliver or sort the mail. So they had to suspend services until, you know, they got somebody else in there to work, or whoever had come down sick had recovered. I didn't find any suspended services here in Missouri, but I did find some where it was reduced. So you have a lot of these smaller rural communities where you have just like a postmaster or postmistress for the community or the town center. And if they don't have somebody else that can, you know, step into their shoes, or maybe the whole family sick, those would have been reduced until they came back from this illness. You also have the Committee of the American Public Health Association very early on starts putting out these notices and kind of information bulletins. They give them out to public health boards kind of across the nation, but they're also publishing in national newspapers information about what are the symptoms of the flu, how to combat it, how to prevent it, what you should do if you come down ill. But they also went a step further and encouraged different restrictions, such as, you know, closing down businesses or encouraging stores to stagger their openings, especially if it's in a larger kind of business district where there's a lot of business around. So stagger your openings within that community so that there's fewer people on the streets going to and from work, or even to and from the stores, and then also fewer people on public transportation like streetcars and that sort of thing. And then also pushed for early quarantine measures. So if you're seeing cases of that, go ahead and quarantine. So the committee is part of this U.S. Public Health Service. So this actually, this organization started really very early on in the history of the United States, back in 1789. It was first started as a relief for sick and disabled seamen. They then added on the Marine Hospital Service. In 1902, they kind of broadened who they care for and into the public health sphere, but you still had the Marine Hospital Service as well. And then just a few years prior to the outbreak in 1912, it became simply the Public Health Service. So there's more of a split, a division between the healthcare, between military, and then the general public as well. So that's what we're at now, where the Public Health Service is mainly focused on just the general populace and population of the United States. At this time, it was under the direction of the Surgeon General, who at that time was Rupert Blue. So again, they were putting out health notices and bulletins. They were sending them to local health boards to be able to distribute within their communities, and then also be able to publish in local newspapers, just disseminate it across and as widely as they possibly could. Something else that the Public Health Service did during this time was to bring doctors out of retirement. So you had a very large number of medical professionals, doctors, nurses enlist or volunteer with the Red Cross, with YMCA, and are now involved in the World War I effort, either stateside or overseas, which is leaving a major shortage across the United States. And Missouri is exactly the same. We had several communities that lost the doctor that serviced that entire community, even possibly the county. The problem with some of these doctors that they brought out of retirement is there was a reason that they had retired. Some of them had debilitating injuries that prevented them from doing their work fully. Some of them had gone senile, they were ill. There were even some cases of doctors who were blind, but desperate times call for desperate measures. So at the very least, some of these being brought back in have the experience to be able to at least disseminate some of their expertise to these brand new nurses and doctors that are being quickly trained and kind of put into the front lines of caring for these sick and ill individuals. Some of the health bulletins that were being put out by the Public Health Service included warnings against cures. You see, if you do any sort of search for this time period, there are all sorts of homeopathics, pharmaceutical companies, even doctors, whether real or just claiming to be doctors, putting out different information of, you know, try this cure, try this different tablet or this medication. It's going to stop you from getting the flu, or it's going to cure everything you've got. For the most part, it's all malarkey. We know there's no cure for the flu. At this time, there's no vaccination. There's no preventative care against the flu either. What's really important that I found looking at the Public Health Service was not so much their response during the pandemic, but kind of the response after. It really jumpstarts a lot of what we see today in kind of modern medicine and healthcare. So you see a rise in the study of epidemiology. So looking at how disease spread within a population and that sort of thing, trying to understand what causes that, how it happens, and how to prevent it. And then there's also a rise of a national disease reporting system, so better able to track some of these communicable diseases across the nation and have a better idea and more forewarning to know that, hey, we've now got an outbreak here, this could possibly spread to other states or other locations. You see the rise in consolidated healthcare that goes on globally, not just across the nation. It takes different forms in different countries. You also see the rise in the call for health insurance. So what the 1918 influenza pandemic really showcased was the inability for a lot of people to access healthcare. You have a lot of rural communities that there's no medical facility, there's no hospital, it's just the local either city or county doctor, which if you have one, maybe two individuals trying to take care of an entire community, it can get very overwhelming very quickly. Added to that, some of these rural doctors, not only did you pay for the treatment, but you also paid per mile that they had to travel. So you're paying mileage on this, and that can add up very quickly in some of these very rural, hard to reach homesteads that we have here in Missouri. Added to that, I don't know if any of you have family and have kids, but if they bring some sort of, you know, cold or sniffle home, it's not like the whole family falls sick at one time. They kind of fall like dominoes. So if you're calling the doctor back, you know, once a week for multiple family members, that adds up very quickly. And some families can't afford one doctor's visit, let alone multiple visits. You also see kind of the origins of the World Health Organization. So it wasn't called this at the time period, but you see the need for a worldwide initiative of doctors and researchers coming together to look at these diseases that affect not just one country, not just one community, but the world as a whole. So beyond the national response, looking more closely here at Missouri at the state and local government response, I combined these for a reason, because in the state of Missouri, there wasn't a whole lot of state level response. You have the State Board of Health that, again, very similar to the U.S. Public Health Service, was putting out these information bulletins and health notices of what you should do, what to look out for, preventative measures, that sort of thing. But as far as government was concerned, so in Missouri, the governor put out a recommendation that businesses that have those large public gatherings should close, but really put the initiative onto city and local authority. So it was up to them and their community as far as what kind of restrictions, what kind of closures they should see. And then in November, when you see that second wave of the flu coming through after a number of these restrictions are added, it's the State Board of Health that then puts out a second kind of recommendation of like, we should go back to those closures and stricter quarantine measures. To kind of look at that in comparison, if you look at some neighboring states, Kansas and Arkansas, they both had statewide closures from the governor. So those happened kind of the 7th and 10th of October, and they get specific on what types of locations should close. So not just that whole public gathering, public assemblies, but schools, churches. Arkansas goes a step further and says the fairs as well, and that streetcars should not be crowded as well. They can still operate, but they should limit the number of people on those. Kansas, initially these closure orders go through kind of the middle of the month, but then they end up extending it through the end of October. And then the state opens county by county, depending on the number of cases and then local authorities there. So a little bit different response as far as a statewide response for here in Missouri. So while the governor didn't put out any sort of mandatory closure orders, there are different state agencies around Missouri that had to implement their own restrictions or closures depending on what was happening in their location. So for instance, the State Industrial Home, so up in Chillicothe, they already had some preventative measures in place. This was a location that it was common for them to have outbreaks of, things like chickenpox, measles. It had happened before, so they already had some of those, isolating those who come down with these disease quarantine measures, but they just kind of take them up a notch. And so they further quarantine and isolate, immediately isolating anybody that comes down sick. They have vaccinations. This is not for the flu, but for things like the measles. So trying to take some preventative measures as well. So we have state hospitals across Missouri. I wasn't able to find any outbreaks of the flu, major outbreaks at any of them. I did find some deaths that did occur due to the flu of some of the patients there, but it didn't seem to have spread. So they were able to contain it and stop it from spreading within these hospitals, and they were still accepting patients. So even in October, when you're kind of at the height of flu cases across Missouri, especially even in St. Louis, there's still St. Louis hospitals sending patients to, in this case, to Fulton, to make room for wounded soldiers who are being brought back to be cared for at hospitals there at home. The Missouri State Penitentiary, so they had seen an uptick in the number of cases of the flu in March. So they kind of had a little bit of a warning of how quickly this could spread there. So that first week of October, they went ahead and did quarantine measures. And probably because of that, their numbers stayed relatively low through October and November. But they start seeing some mild cases in December, and they do see a larger number of cases in that December. But by the 18th, they took vigorous steps to stop the spread of the disease. So they again kind of locked down these quarantine measures. I wasn't able to find any specifics on what these vigorous steps were, but they did take measures to, again, stop that second spread that we see later in fall, winter of 1918. So looking at kind of more local cases, we talked previously about Kansas City and St. Louis and kind of their response and what the flu looked like in these communities. I'm going to go a little bit further because they have a much more robust response than some of the other communities across the state. So for Kansas City, you're looking at a very interesting dynamic and kind of political atmosphere already existing prior to the outbreak of this pandemic. You have this 50-50 political split between political offices with Pendergast and Shannon. I'm not even going to try to go fully into that entire situation. It's definitely worth more research on your part to look at that, because it really, basically for this situation, it made a clear divide of there's not going to be cooperation across that line to even attempt to come together as a whole and combat this as a group. It was very individualized. And some of that political tension and divide also leaks over into the health officials and the health advisory committee that is in Kansas City. So initially, Dr. Gannon, he is kind of the head for the Health Advisory Board in Kansas City. He's the director of the health department's contagious disease department. And he really takes it early on in trying to put out quarantine measures and closure orders and informing the public of how this disease is spread, what to do if you come down ill. So he's really trying to push forward. He has a few more, I don't know that I would call it radical ideas, but he really gets it into his head that a lot of this spread really started with a couple of young women going to the Sweeney Motor School and kissing boys there. The first outbreak of the disease does start at the motor school, and so he's assuming that's how it's spreading, which is entirely possible. I don't know that I would blame it entirely on some sweethearts kissing, but so a lot of that kind of thought was used against him in the press. They're like, oh, you know, nobody should be kissing anyone. Dr. Gannon says no, and it kind of undermines a little bit of his authority there. Some of the other players that we have during this time period is Dr. Bullock. So he's the health director and the head at the General Hospital there in Kansas City. And then Mr. W.P. Motley is the president of the hospital and also of the health board. He has no medical background himself, so his is more of a political position. And there begins to be very early on a schism between Motley and Gannon that ultimately ends up with a secret meeting, and Motley ousts Gannon, and he's you know, thrown off of the health commission, and it's this whole big drama, and a lot of focus goes on to this feud between them rather than to closures and trying to enforce these closure orders. So some of them were in place and they lasted longer than other major cities across the United States. So to a degree, they were somewhat successful in looking at the larger picture, but there really wasn't much enforcement. Some health officials were able to go around to different businesses that had been reported as not following the rules, and they put, you know, this, you know, business isn't safe or isn't following these health guidelines, but it really didn't go much further than that. Dr. Bullock kind of takes over after Dr. Gannon is fired and you know, shoved out. He tries to kind of carry on with these closures and the restrictions, but for the most part, he sees it really as kind of a losing battle at this point. So it's really, some of it takes effect, but for the most part, everybody's just pulling in opposite directions and they're just not getting anything done. In contrast, on the other side of the state in St. Louis, for the most part, the mayor and kind of the politicians of the area take a very hands-off approach in regards to this. Early on, even before you start seeing cases break out in St. Louis, there's meeting of community leaders. So this includes the health commissioner, who is Dr. Max Starkloff at this time period, but also the mayor, the assistant health commissioner, health department, the Chamber of Commerce, dean of Washington University, St. Louis Medical Society, the United States Postal Service, and also the Public Welfare Office. So they bring in not just politicians and leaders of the communities and health officials, but they're bringing in kind of the whole gamut. So the Public Welfare Office, the Chamber of Commerce, so they're including businesses and universities, trying to get a wider spread of those who are going to be affected, those who are going to need to know what sort of restrictions and closures are going into place. And because of that, because they already had those meetings and that kind of cooperative effort working on, when Dr. Starkloff starts seeing cases in very early October, and you put down those closure orders as of October 7th, they go out city and county-wide in some places, and they're enforced. So you have police enforcing some of these closures, but beyond that, a lot of cases of what I see across Missouri is these closure orders tend to be somewhat general, or they only focus on places where there's large public gatherings of people. So schools and churches and theaters are kind of the main ones you usually see displayed, and then they kind of just say public assemblies, which can be interpreted in any number of ways and often were in some communities. So here in St. Louis, Dr. Starkloff actually went a step further and gets that itemized list of here's all of the places that are going to be closed. So all of those you would think of, but also playgrounds, dances, railroad cars have to be ventilated. You have to keep the number of people on streetcars down. You can't overcrowd those. Cabarets, lodges, and societies can't meet up. Public funerals, parades, and even the municipal courts at some point have to close down. So he's taking that step further and making it very clear as to what all has to close down and for how long. Also, physicians are required to report any new cases or outbreaks of the disease, otherwise they're going to be fined. And then, so with all of these restrictions, they go into place, they're enforced, and it does make a difference. You see a few other communities kind of following this example as well, go ahead and do those very strong restrictions and shut things down tightly very quickly and very early on to try and stave off the spread of this disease in early October. So now moving on to kind of the military response. So this, we're going to be looking a little bit outside of Missouri as well, because we have over 150,000 Missourians who served in the military during this time period. So for the most part, those exposed to the flu are going to be exposed outside of the state of Missouri in most cases. We also had, many, many more who also volunteered with YMCA and the Red Cross. So especially those YMCA and Red Cross workers are going to be that much more exposed, because those are usually, many of those are in hospital settings where they're actually caring for sick individuals who have come down with the flu. To kind of put this into perspective, approximately 11,000 soldiers died, Missouri soldiers died during World War I is one of the numbers that I came across, and about an equal number of Missourians died due to the flu. So we had kind of a major hit to the population and just to the people here of Missouri. But the military, as you can see here by this particular ad that I found in a newspaper, they are also, so this is just in a Springfield newspaper, they're putting out information on how to stop the spread, what to do to prevent yourself from getting it. So they're also, their medical corps is putting out this information to also try to help stave off and stop the spread of the disease. As far as the military go, about some of the numbers that you see of the sick, about 26% of the Army personnel come down sick with the influenza. This next number, this is the one that really gets me. Approximately 8,743,102 days were lost due to illness as far as Army soldiers. This is both stateside and overseas. Over 8 million days. That has a major impact. So even though we talked a little bit earlier about they're still sending troops overseas, they're still moving them around the country for different training facilities and that sort of thing. However, the number is somewhat reduced because you have just so many of them down sick. You're not going to be moving them while they're ill generally. You can see here, there's a description here of kind of what the flu symptoms were like. Those very severe cases, it wasn't something that you can just, muscle through. It literally just laid you out flat, sick as a dog. So there was no moving them around, which really impacted kind of the war effort during this time period. However, there still were, if you were able-bodied and you weren't showing symptoms, you were still possibly going to be shipped either to another base or possibly even overseas at this time period. So looking more closely to home, so here in Missouri, Jefferson Barracks, you have over 200,000 troops from not just Missouri, but other states as well, who actually passed through Jefferson Barracks during the entirety of World War I. So a lot of soldiers through here, definitely a place to keep an eye on in regards to outbreaks. And this is actually one of the places that Dr. Starklov in St. Louis kept an eye on. You saw in some of the cities further east in like Boston, Philadelphia, and that sort of thing, cases tended to erupt first in military camps and bases before then spreading to civilian populations. So he was keeping an eye on Jefferson Barracks for sure, and it proved true again here because you have the first cases reported as of October 1st. So that was the first warning shot for St. Louis to know that, okay, we need to start putting some of these closure orders and restriction policies into place. What happens here at Jefferson Barracks is, so you see on the first couple of cases start coming into the hospital. This newspaper article on October 2nd, word hadn't gotten out yet that they were already seeing cases. So you still had individuals coming up to Jefferson Barracks to enlist. The military draft had been halted at this time period, so they weren't drafting anymore, but you were still able to enlist, as far as I can tell, in most, if not all, locations. So that was still happening. But by the 4th of October, you have 500 cases, and then by the end of that week, there are over 800 cases at Jefferson Barracks. In total, they saw about 2,000 cases across that entire time span through that fall, winter of 1918. They did receive some aid from the local Red Cross chapters, and actually Jefferson Barracks saw a lower number of cases than some of the other stateside military bases. This may be in part when they see those first cases in early October, the commander of the base effectively shuts things down. There's no more entertainment, so you don't have those large gatherings for any sort of entertainment. You're not allowing visitors onto base, and he's not giving any more passes for soldiers to travel off of base. So basically, we're quarantining the camp, and that seems to have helped keep the numbers down. So we talked a little bit about Dr. Eugene Opie previously. So he's just kind of our example for the Army Medical Corps. He was Dean of Pathology at Washington University, but the U.S. Army Medical Corps, even prior to this outbreak in 1918 of the flu, was already looking at some of these communicable diseases and secondary infections. So there was already a team in place. They were stationed at Camp Funston at one point, but then also other locations and bases across the United States, studying and looking at how things like pneumonia were spread among those who were sick with the flu or the measles. So you get a lot of really good data and information that comes from this, and then a lot of information on how to possibly prevent this in future cases. So Dr. Opie himself actually wanted to take it a step further in some of these measures, both in treating the flu and then also in preventative measures. So he recommended completely isolating flu and pneumonia patients. So not just have like a wing of the hospital where it's all flu patients, but individually each patient should be quarantined away from the other, just so if one of them develops pneumonia, he's not then going to pass that along to someone next to him. Unfortunately, during this time, you had so many come down sick so quickly all at the same time that it just wasn't possible. There wasn't enough resources to be able to do that. He also called for what he called seasoning of troops. So he wanted newly enlisted and drafted men to go to a specific base where they did some of their training, but they basically exposed each other to each other's germs, and if there's any sort of outbreak of measles or the flu, they're quarantined there together. They're not going to go to other bases and possibly spreading. They're not going to be bringing in more new troops that are then going to be infected again, and just let them kind of ride out that wave of illness. And then once everybody's healthy and well again, then they can be moved on to a different location for further training or to be deployed. During World War I, that just was not possible. They needed troops, they needed soldiers, and they needed them now. So it was, you got to base, you were trained, and then you were moved on to your next assignment. But some of this has transcended past World War I as far as how to care for some of these diseases. And then military hospitals in particular. So we talked a little bit about Base Hospital 21. So you do have Missourians either with the Red Cross or in military service in the medical corps who are caring for flu patients overseas, but also here stateside. This letter here towards the bottom is from Alvin Florian. He's writing back to one of his professors actually from medical school, and he talks about the need for a pharmaceutical corps within the Army. So he wants a further division within that medical corps looking at drug research and using different pharmaceuticals for prevention and treatment of some of these diseases. Take it a step further and not just be a corps that treats illness, but try to do some research and some preventative measures as well. What I found interesting in some of these cases for some military hospitals on military bases, mostly across the US, once they had gotten their flu outbreak under control, some of those doctors and nurses were asked to volunteer in their local communities. So while they may have it under control on base, some of the civilian hospitals were still inundated with cases of the flu. So they were asked to go volunteer and help care for those patients as well. So you have some military personnel moving out into the public sector to help care for some patients as well. So the American Red Cross, they are really kind of the heavy hitters throughout the entirety of the pandemic. So for World War I mean, they were already well active and organized even prior to the outbreak, which really helped, I think, in terms of their response and their ability to respond. So you have over 24,000 nurses who are enrolled in the Red Cross during this time period. And it's not just nurses. Most of them have that basic training. Some of them are, were nurses in real life. Some of them receive training after volunteering. But they go a step further, and it's not just medical care that they're providing or assistance. They're also offering financial advice for families of soldiers. They're caring for the sick and wounded, travel assistance. So they're in hospitals, but they're also stationed at railroad stations or places where a lot of soldiers are going to be transported through to see, is there anybody that got injured on the train ride? Is there anybody that's come down sick? Can we care for them here and send them onto the base, or do they need to be pulled off and sent to a hospital? And then the Red Cross goes even past Armistice and continues to work with the U.S. Public Health Service to continue providing care during the pandemic. Again, we have Armistice in early November, but we still have that second wave of the flu that really hits in November, December, and in some cases go all the way into January. So they're still providing care both for military personnel, but also in the private public sector as well for flu patients. One of the things that the Red Cross set up were these canteens, emergency hospitals. Sometimes they were separate entities, sometimes they were one and the same. In places like Kansas City, there was a canteen set up at the railroad station there. So they would, if they encountered any sick soldiers on the train, they'd pull them off or render care. So some of these writings that you can see here, these are reports from the Red Cross canteen there in Kansas City, where it's saying sent 6 soldiers to the hospital with influenza. So you're pulling 6 of these patients off of the train and sending them to the hospital there locally because they've come down with the flu ever since they got onto the train. They're also providing assistance, direction to soldiers where they need to, just some friendly conversation in between train trips. Some of them you just have nurses, some of them have doctors there on staff. You also have emergency hospitals. So in Springfield, there's actually, they call it a canteen hospital, but they also set up a secondary emergency hospital within Springfield at the Christian church there that were staffed by Red Cross workers. So the canteen hospital was mainly just for soldiers initially, and then as the flu starts breaking out in Southwest Missouri and in Springfield in particular, they set up a secondary location to also care for anybody in the civilian public population that comes down ill with a disease. You have other locations across the state of Missouri. Most of them I have found were churches, or in some cases even hotels, or different buildings on universities that are being offered or used as kind of these emergency hospitals. If possible, in places like Columbia and St. Louis, some of those are staffed by medical students and some of the trainers and teachers at these medical colleges, but quite often they are going to be at least somewhat staffed by Red Cross workers as well. One of the other programs they have is this ambulance and motor corps. So they provided a couple of different services here. They operated as a typical ambulance. Many of these were actually stationed at railroad stations in places like St. Louis, Kansas City, Springfield, where you have this major influx. And they're able to take any wounded soldiers and then eventually those flu patients straight from the station to the hospital, which greatly reduces possibility for further spreading of the disease. No one's having to do public transportation while feeling ill trying to get to the hospital. In some cases, they went out from the hospitals and picked up severely ill patients within the community and brought them back to the hospital as well. But also the motor corps had a couple other jobs as well. So some of those health bulletins that the Red Cross and the U.S. Public Health Service and local health authorities and commissions were putting out, they would distribute those within their communities. Again, you had to have a Red Cross chapter in your community. You had to have one that had access to cars and drivers. So not every community across the state of Missouri saw this. This tends to be in larger communities, and even in places like St. Louis, those health bulletins didn't make it into every community. There were a lot of them that there weren't enough cars, there weren't enough drivers, so they didn't make it into every community. On top of that, for the most part, what I can find is all of these health bulletins are written in English. I wasn't able to find any examples of them, for instance, written in German. So if you've got, I know there was a large German population and communities within St. Louis. So if they're not speaking English, they're not able to read and disseminate that. I will put a caveat into that. There were still a number of newspapers in the state of Missouri written in German. So within those, you would find some of those health bulletins, those national ones that had been put out, had been translated into German and then put into these newspapers and distributed within the German community. So you saw a lot of these communities. It wasn't just nurses, but it was drivers who, again, many of them women, who volunteered for the Red Cross as these part of these motor corps, and some of them had a personal vehicle, others were provided by the communities in which they lived in. Other projects by the Red Cross, you'll see many examples and many photographs of Red Cross workers putting together masks, and this is for other nurses, doctors, medical communities, that sort of thing, but they also put information out into the public. Again, more of that information on here's what flu symptoms looks like, here's how to prevent it, here's what to do if you come down ill, but also here's how to make a flu mask, and trying to, a lot of these homemade ones, as we're seeing today, weren't terribly effective, but here they're trying to go a step further, and it's got to be medical gauze, and it's got to be so many layers thick and that sort of thing, just trying to give more information out into the community. As with other organizations during this time period, it's really what happens after with the Red Cross. World War I and then the pandemic on top of it really brings home the realization that there is a lack of medical professionals in the United States. There's that lack of concerted healthcare and equal healthcare across the nation. So you see kind of that rise and that call for more people to go into the medical field, to go into nursing and to be doctors. Moving on from the Red Cross, this actually wasn't originally in my first research, so this is thanks to Sue, so an archivist with Missouri Diocese, kind of brought this to my attention. Most churches across the state of Missouri were closed due to local or city orders. However, there's a couple of cases that I was able to come across with the Episcopal Church and the Catholic Church that they actually put out closures across the entire denomination. So the Episcopal Church in early October all the way through mid-December were closed. So there was no visiting from clergy, there was no coming in for services, no confirmations, that sort of thing. The Catholic Church, that comes out a little bit later and it doesn't extend quite as long as far as I can tell, but the Archbishop there in St. Louis does tell churches to follow the health department advice and go ahead and close. They still allowed individuals to come in and pray. Priests were still able to do daily mass, but if they found that people were starting to congregate there in any sort of groups, they needed to completely close and lock all of the doors. And again, a lot of these churches are closed for services, but they are being utilized as emergency hospitals across the state of Missouri. Okay, so looking at some of the universities, many of them, again, you have to follow local orders, so it differs across the states. Places like the University of Missouri, they closed down in early October. What I found really interesting about them is they went ahead and canceled the entire football season. Other universities did not, but also when they closed down in October, students were required to maintain, to stay on campus, because they reopened again in November, but when the second wave comes through, they closed again and decided they were just going to be completely closed through the end of the Christmas holidays, and students then went home at that point. Again, University of Missouri, you have medical college there, so some of the, there was a hotel downtown, also the hospital there, and one of the residence halls were used either for housing nurses and medical staff, but then also some patients as well. So they stayed on even after the university closed. A couple of the other universities across the state, you have similar reactions, but some of them, like Washington University, they were closed for an entire 6-week period. That's probably the longest one that I was able to find in regards to one single closure. But on top of that, you still had medical students and teachers who were still there on site caring for any flu victims that came into the medical college, the medical hospital there. Missouri School of Mines here in Rolla, there were so many faculty and students who enlisted during World War I that there really weren't a whole lot of students or faculty left here on campus. Added on top of that, there really wasn't a major outbreak of the flu here in town. So there was no real closure for the school. And also they maintained their football season. They had to rejig their season a little bit and find other universities that had stayed open and that were still playing football to play with. One of those was actually Southeast Missouri Normal School, so SHSMO down in Cape. They were still maintaining their season. They did close down classes for a period in there, a shorter time frame. The State Normal School, so what becomes Missouri State University in Springfield, closed October 1st by the city health commissioner there. I wasn't able to find when they reopened, but they were at least closed for part of October. And then up in Kirksville, they closed in early October, and then they reopened at the end of October and extended their semester through December 21st, trying to make up for lost time. So a couple different reactions by universities across the state of Missouri. So going more specifically just into the medical community for Missouri, I like this quote, this doesn't work, that doesn't work, nothing worked. Unfortunately, that was quite the case. You were really inundated by such a huge number of patients during this time period that there's really not a lot of room for research and investigating to see if different types of treatment would work. Everybody's just kind of being run ragged trying to care for all of these patients. But there are some things that come out of this. One of this is the Visiting Nurses Association. So here in Missouri, public health nursing, so these are trained nurses who go out typically into poor communities, underserved communities, to provide nursing care for sick and invalid individuals. That starts in Kansas City in 1891 out of a ladies' society from the First Congregational Church there in Kansas City. And then they organized into this Visiting Nurses Association in 1892. St. Louis, they initiate their own Visiting Nurses Service in 1895, and it's incorporated in 1911. So you have both of these kind of entities existing somewhat outside of the Red Cross as well. So they're both doing very similar jobs, but these visiting nurses, they're not working in hospitals. They're actually going to homes and trying to care for the sick within their homes. Kind of out of this visiting nurses, the rise with the Red Cross and the work they do during the pandemic in 1918, you see a growth in the number of nurses in rural communities and the call for nursing within those communities after this pandemic. They realize it's not just having a doctor on call, but it's having a nurse that can provide some of that day-to-day just care and watching for secondary infection that made all the difference on whether someone survived this disease or not. You also see a lot of hospitals having to adapt during this situation. Many of them are just overrun. You have patients sitting out in chairs in the hallways waiting for a bed to open up. And in that case, that's someone either recovering enough to go home or someone has passed away from the disease. Very early on, you have cases where hospitals are trying to sterilize the bodies of those who pass before they send them on to the morticians to, again, try to stop that spread. However, very quickly, they get inundated with so many individuals who have died that they just can't maintain that level of trying to disinfect and stop the spread. Emergency hospitals are set up across Missouri. Sometimes private hospitals are asked to open their doors to the general population and to bring in more flu patients. One of those is St. Mary's in Kansas City. So they actually opened their doors to the public once the general hospital was kind of overrun with cases. But that in itself can lead to issues because I don't know that it was all. I think it was most of the nursing nuns, the sisters that were there, actually came down with the flu, and they actually lost a couple of them who died from it, and one of the doctors there as well. But kind of out of this, a lot of communities see that need for an established, some sort of medical facility or a hospital within their community. So you do see more hospitals built after this time period. You also, again, see more research. People are trying to understand what caused this. How did it spread so quickly? Why did it kill so many people? So I mentioned that epidemiology, but you also see the rise of virology. So more of that understanding of what is a virus, how does that spread, the fact that it can't be treated, but it has to run its course, but how do we prevent that? And that really the flu virus isn't isolated until the 1930s, and you don't see the true first vaccine until the 1940s. So even though you have this major devastation worldwide, it's still several decades before you see any sort of preventative vaccine that's even available. What I found really interesting is that the particular strain of the 1918 flu wasn't really understood until much, much later. So there's a mission in 1915 up to Brevig Mission, Alaska, where they exhumed people who had had the flu and who had died from the 1918 influenza, and they were trying to isolate that particular flu strain and just fully understand why was it so virulent, why was it so deadly. Unfortunately, that was an unsuccessful attempt, and it wasn't until 1997 when this kind of same team did a second attempt and they were fully able to isolate it and really understand it. So that kind of blows my mind almost 100 years later, and that's when you're just really starting to kind of understand what even caused all of this, what made this one so deadly. So if you're interested in that, I definitely recommend reading up. There's a lot of good information out there, but it's really because of this pandemic that you see a lot of what our health community, our medical community looks like today comes out of such devastating number of illnesses and those that passed away from it led to a lot of what the medical community looks like today. So it's not so much just their response during that time period that's interesting, but the response in the years to follow as well.
Katie, that's an excellent presentation. A lot to pack in and unpack all at the same time. So much of the information you pulled, was a lot of that from our archives? What were some of the sources that you were able to get the information for this?
Yeah, so I pulled from a lot of different resources. So we have some of those materials here at the State Historical Society. A lot of it was from newspapers from that time period. I was also able to find a lot of medical articles, especially in Missouri Medicine is one that I really focused on, because they had a lot of articles specifically about Missouri, what the 1918 flu looked like here during that time period. So there's a lot of really great information out there available online. Some of it I had to, dig through the archives, but a lot of great resources and a lot of different locations to find them.
Karen just asked, if there was no vaccine until 1940, how did the virus go away ultimately?
I'm not a medical professional, but from everything that I've read, with viruses, they mutate. Those that are more deadly tend to mutate out. If you kill the host that you're in, the likelihood of being able to spread means it dies out that way. So really what comes out of the 1918 is it was so deadly and so virulent. So many people came down sick with it. To a degree, those that recovered would have gotten some sort of immunity. So, there's not going to be that cross-contamination back again. But then also, eventually, that strain of the flu mutates out to a less deadly version of it, if that makes sense. That's a very simplified explanation to it, because you do still see cases in spring of 1919 where a larger than average number of individuals died than had in previous years. And then kind of after that, it got back more to normal numbers, if that makes more sense. Yeah.
Let's see. Susan also asked, did the name Spanish flu finally get changed so the blame fell off of Spain?
So that really doesn't happen until much later, and you'll still see, usually it's in quotation marks of Spanish influenza, simply because that's what most of, even today, the world population still knows it by. But if you see it in any sort of official or medical text, usually they just refer to it as the 1918 influenza pandemic. They give it that more general term, or, you know, some medical jargon that I can't pronounce. But yeah, so in more official writing, it tends to be that 1918 influenza. But in a lot of even historians writing about it, because they're writing in the context of what it was in the past, you'll still see the Spanish flu crop up, but usually there's that explanation of they were simply the first ones to report and to be prolific in their reporting on the flu, rather than that being where the flu broke out.
Absolutely. Well, Katie, we are out of time. We went over a bit, but we thank everybody for joining us. And again, you can check back with State Historical Society for more programs like this. And Katie, wonderful program once again. Thanks to everybody for joining us, and have a great afternoon.
Thanks for being here, guys.